Hi, my name is Megan. I apologize if I sound a little odd. I'm a little bit under the weather. So today I'm going to talk with you about a medication called Eliquis, also known by its generic name Apixaban. Eliquis is an anticoagulant, also known as a blood thinner. A common reason Eliquis is prescribed is to lower the risk of stroke in people who have a heart rhythm problem called non-valvular atrial fibrillation, also known as AFib. AFib can cause the blood to pool in the heart, which can allow a blood clot to form. So when the blood quits moving and it is sitting there, that's when it starts to clot. If that clot travels to the brain, it can cause a stroke. Eliquis helps lower the risk by making it harder for blood clots to form. Eliquis is also used to prevent or treat blood clots in other situations, including deep vein thrombosis and pulmonary embolism. So how does Eliquis work? Normally, your body has a series of steps that help your blood clot when you are injured. One important part of this process is a protein called factor XA. Think of factor XA as an important switch in the clotting process. When factor XA is active, it helps your body make thrombin. Thrombin then helps create a blood clot. Eliquis works by blocking factor XA. By blocking this protein, Eliquis decreases the amount of thrombin your body makes. This slows down the clotting process and makes it less likely that a dangerous clot will form. Eliquis does not directly destroy a blood clot. Instead, it helps prevent new clots from forming and existing clots from getting any bigger, while your body continues to break them down. Eliquis does not, unlike warfarin, routine INR testing is not used to measure the effects of Eliquis. Standard clotting tests such as PT, INR, can slightly change with Eliquis, but these tests are not reliable for measuring how effective the medication is. So now let's talk about what the body does with Eliquis. Eliquis is taken by mouth and then absorbed into the bloodstream. About 50% of an oral dose is absorbed, and the highest blood levels usually occur in about 3 to 4 hours after taking the medication. Food does not significantly change how much Eliquis is absorbed. Once absorbed, about 87% of Eliquis is bound to the proteins in the blood. This medication is mainly broken down in the liver, especially by an enzyme called CYP3A4. Eliquis leaves the body through both the urine and the stool. About 27% of its clearance occurs through the kidneys, while the rest is mainly eliminated through the digestive system. And its half-life is about 12 hours, which is one reason it's taken twice a day, usually. Because the liver and kidney helps this process and removes Eliquis, your healthcare provider may need to consider your kidney and liver function when choosing the safest dose. The most important side effect to know about Eliquis is bleeding. Because Eliquis slows blood clotting down, you may bruise more easily, have nosebleeds, notice small cuts take longer to stop bleeding, and more serious bleeding could also occur. You should contact your healthcare provider if you have any unusual or prolonged bleeding, blood in your urine, black or bloody stools, vomiting blood, or have unusually heavy menstrual bleeding. Seek emergency medical attention for severe bleeding, a serious injury, coughing or vomiting blood, severe headache, or symptoms that could suggest bleeding in the brain. It is also important to tell your healthcare provider about all the medications that you take. Some medications, including certain NSAIDs, such as ibuprofen, aspirin, or other blood thinners, can affect the CYP3A4 or P-glycoprotein and can increase your risk of bleeding or change the amount of Eliquis in your blood. It is a very important safety point that you do not stop taking your Eliquis on your own. Stopping it too early can increase your risk of developing a blood clot, stroke, or another serious problem. If you need to stop taking your Eliquis because of surgery, a procedure, or another medical reason, your healthcare provider should give you specific instructions. Eliquis can now be used in certain pediatric patients as well. The current prescribing information includes Eliquis for the treatment of venous thromboembolism and reducing the risk of recurrent VTE patients from birth through 17 years of age. after at least 5 days of initial anticoagulation treatments. For children, the dose is mainly based on body weight, and specific pediatric formulations are available. Eliquis is not recommended for children weighing less than 2.6 kilograms because these patients were not studied. Because children have different body sizes and different developmental differences, parents and caregivers should never change a child's dose without talking to the healthcare provider. Some other special considerations include older adults can also take Eliquis, but extra attention needs to be given because of aging. It can affect your kidneys, body weight, and the risk of bleeding. For patients with non-valvular AFib, the usual dose is 5 milligrams twice a day. However, the recommended dose is reduced to 2.5 milligrams twice a day. My apologies, I meant 5 milligrams twice a day. Is usually reduced to 2.5 milligrams twice a day when a patient has at least two out of the three characteristics: being 80 years old, weighing 60 kilograms or less, or having a serum creatinine of 1.5 milligrams per deciliter or higher. Healthcare providers should also review other medications and kidney and liver functions to help reduce the risk of bleeding. So overall, Eliquis or apixaban is an anticoagulant that helps prevent dangerous blood clots from forming by blocking factor XA, which helps reduce thrombin production and slows the clotting process. It is important to remember that Eliquis can increase your risk for bleeding, and you need to take it exactly as prescribed, and tell your healthcare provider about all other medications and supplements you may take, and to never stop the medication without medical guidance. If you experience signs of serious bleeding or have an injury while taking Eliquis, seek medical attention right away. Thank you for listening.